At RespShop, we've been helping customers with CPAP therapy for over 16 years, so we know a thing or two about troublesome CPAP issues that plague beginners and first-time users. To make life easier for you, here's our guide to the top 5 problems people have when starting CPAP therapy and how you can solve them. I'm going to cover stomach bloating, dry mouth, dry eyes, problems falling asleep, and general discomfort. Now, most of these issues can be fixed with some setting and equipment tweaks or by adopting some simple best practices, so don't let them get in between you and that glorious realm of sweet dreams. It can be hard at the beginning, but trust us, it's worth it. So let's start with problem number 1, stomach bloating. The proper name for stomach bloating is Aerophagia, and it happens when you swallow air into your stomach. If this air builds up too much, it can be very uncomfortable, and at some point, that air will have to escape and, well, I'll spare you the details. There can be a few causes of this, so fixing it might take a bit of experimentation. It might be that your pressure settings are too high or even too low. If they're too high, the extra pressure might overwhelm your lungs' capacity to intake the air, and the excess air forces itself into your stomach instead. But if it's too low, you may have more gasping apnea events, which means you suck air into your stomach that way. The solution here is to get your therapy pressure settings just right. This should be done in consultation with a physician, but a general principle is to keep your apnea events under control at the lowest pressure possible. If your apnea-hypopnea index, or AHI, which measures your apnea events and appears in your sleep data, is 5 or less, it should be fine to reduce the pressure settings just a little. But especially for beginners, talk to your doctor about that before adjusting any of these settings yourself. Separately to this, you can also use pressure relief settings on your exhale if your machine allows it. Now, this feature goes by various names depending on your CPAP brand, like EPR or Easy Breathe. Although whatever name it goes by on your machine, it will drop the pressure when the therapy algorithm detects that you're breathing out. The level of drop will depend on the setting that you put for this, so it can be tweaked to make sure that you're able to sufficiently empty your lungs and then have the capacity to breathe air back into them without swallowing it. So increase the relief setting if you find exhaling difficult. Mouth breathing can also be a cause of stomach bloating, but I'll deal with that in the next one when I talk about problem number 2, dry mouth. Having a dry mouth in the morning is horrible, and it can also have associated health problems like tooth decay. The cause of it is actually pretty simple. High pressure air rushing through your upper airways, but especially your mouth. One thing to check straight away is whether you're breathing through your nose or your mouth. Breathing through your mouth is to be avoided if possible for this very reason. Here are some ways to stop mouth breathing if you find that this is happening to you. Now, if you're congested, this could well be the cause, and if you're unwell, this can be pretty difficult to fix. But there are nasal irrigation machines that can decongest you. I've done a review of one of them linked above me and in the description below. But sometimes mouth breathing is just developed into a bad habit. If that's the case, a chin strap might be a good option for you, as it can train your mouth to stay closed at night, and it's usually a temporary thing and not very expensive. But dry mouth might not be, or not just at any rate, because of mouth breathing. It can also be because the air coming from your CPAP is dry and cold. To fix this, make sure you have a good humidifier and the humidity settings are right for your sleep environment. These settings can easily and safely be adjusted in your menu without needing to consult with your doctor. And if you don't have a heated tube, getting one of these can really help keep the air warm as well as moist, which helps to avoid dry mouth. And they aren't a great expense if your machine has the feature to accommodate one, so we'd recommend you get one. Finally, if your machine supports preheating, use it. That will ensure you get warm and moist air delivery from the moment you put the mask on. Just remember to activate it about a half hour before you plan to sleep, and don't forget about it once you have it on. Problem 3, dry eyes. You get dry eyes when your mask leaks jets of air upwards into them and dries them out. Artificial tears and the like might be a temporary help, but the real solution is to fix the leaks. Here are some tips for that. First, make sure the mask headgear is the correct tightness, which means not too loose or not too tight. Too loose and air can simply force itself out. Too tight and the cushion will probably wrinkle, creating little escape tunnels for the air through the wrinkles. If the tightness isn't right, adjust the straps of your headgear until it is. I'll show you a trick for that in just a bit. You also need to make sure that the cushion is sealing well to your skin. To get a good seal, make sure your skin is free from oils. I like to wash my face with a gentle soap before bed, and make sure that your cushion is free from oils as well by changing it at the recommended replacement rate, and keeping it clean by using mask wipes and regular soap and water cleaning. The way to know if you're in the sweet spot for minimizing leaks is to run a mask leak test before you sleep. These are pretty standard for CPAP machines now, so check the menu for running that. This will test your mask with your therapy pressure and tell you whether your seal is good before you sleep. If it isn't, Try experimenting with the headgear tightness and cushion seal until you pass the test. And if your machine doesn't have this test or you can't find it, a good manual way of getting the right tightness is to take your middle finger and index finger on both hands. You should be able to tuck these under the straps on either side at the same time. If you can't, then the seal is too tight. And if you can fit more than 2 fingers on each hand, then it's too loose. Now, if you're having consistent problems with mask seal, you might have the wrong mask size. Headgear and cushions come in different sizes based on your head and nose shape and size. Get these properly measured if you have concerns. You could also try changing the kind of mask that you use. For example, by going from a nasal cradle mask to a nasal pillow mask. Different kinds of masks have different strengths of seal, and some work better with certain nose shapes than others. Problem number 4, trouble getting to sleep. CPAP machines help to keep you asleep, but they certainly don't help you to fall asleep. And this can be difficult, especially for beginners. After all, the machines make a noise and they force air into your nose and mouth. Now, noise can be tricky because what counts as noisy is a subjective matter, and the overall level hugely depends on the machine that you're using. The official decibel readings that they come with can work as a rough guide, but that's really all they are. It's a very personal matter. Some machines can be made quieter with things like tube mufflers. This is something you might need to research further for your own machine. We have some tips for some machines on our channel, and you can always help things a bit by making sure that the air filter is clear and regularly changed. Some of this though, as with many things to do with CPAP, is a matter of just getting used to it. If too much pressure is a problem when you're trying to sleep, then there's a feature on almost all CPAP machines that's called ramp. The idea here is that the pressure begins at a lower level while you drift off and then ramps up to therapy pressure either over a set period of time or automatically when the algorithm detects that you have nodded off. And reducing your pressure settings while you fall asleep by turning on ramp will typically lower the noise while you drift off as well. So look for the ramp feature in your settings menu and check that it's on if this is a problem for you. Problem 5, general discomfort. Now, if we were meant to wear masks while we sleep, we would have been born with them attached to our faces. So no matter what you do, there's no escaping the fact that this isn't quite the natural way of things, and there will probably be some discomfort, especially in the beginning. But that doesn't mean you can't do some things to help. If you're a new user of CPAP, you may be suffering from claustrophobia. This is very common with new users. Also, the very fact of trying to sleep with all this new equipment on and around you can make it harder for you to relax and enter a sleep state. If that's you, it's good advice to wear your mask while you're awake and doing other things to get you used to wearing it. Maybe try wearing it while you read something or you're watching TV for half an hour. The idea here is to get your body used to being in a calm state while you're wearing it so that you associate the mask with pleasant and calm situations, and the association carries over to when you need to sleep. You can either do this practicing with the pressure off or while the CPAP is running, whichever you find most appropriate. If the discomfort for you isn't a problem about getting used to it, you can try alternative kinds of equipment. For example, some masks have tubing that attaches at the head, some at the front. Depending on how you typically move in your sleep and your regular sleep positions, some could be more comfortable than others for you. Then there are other accessories like tube lifts and different tubing diameters and lengths that can change the weight and feel of the equipment. Experiment here for what works for you while you get used to this new equipment. But the most important thing to remember, no matter what problem you're having, is keep going. It's difficult for everybody to begin with, but with some perseverance and a little experimentation, you will find a solution that works. And then you can finally get those good nights of sleep that you so desperately need. Also, please know that at RespShop, we're here to help you succeed in your CPAP journey. If you want to talk to us about your difficulties and possible solutions, then give one of our qualified technicians a call. Or subscribe to our channel and watch some of the other helpful videos that we have. If you keep at it, it will be no time before you find that you as well can sleep tight. Bye-bye for now.